I'm going to clean it with chlorhexidine here.
Back-to-back injuries, one to each shoulder, eventually led Anthony Jackson to this treatment room inside Gulf Coast Biologics. Both dislocated and banged up while in the Army. The first one in 2000 when doing a parachute jump.
And my canopy was reinflated. I was slammed backward into an ambulance, popped out.
The second one in 2003 while serving in Afghanistan. A rocket landed right in front of his truck.
Blew me out the side, landed on my right side in a bit of a ditch.
20 years later, and now medically retired from service, the Army vet hopes this platelet-rich plasma is the miracle elixir. He's tried everything else, toughing it out, painkillers, countless physicians.
Physical therapy tracks and a lot of steroidal cortisone injections.
His MRIs and the ultrasound. And what we found is we found degenerative labral tearing on the bilateral labrum.
On the other side of this live stream, 60 physicians at a conference watch. It's part of their training. Behind Jackson, countless other soldiers who are also part of Veterans in Pain, or VIP, an organization linking our heroes with healing.
Chronic pain is not acknowledged or understood as being a centralized systemic autoimmune disease of the CNS. Therefore, no therapeutic program is available.
According to the organization, there's a 3 to 4 month long backlog of chronic pain veterans waiting to see a physician. And when they do see a doctor, the primary treatment is usually prescription medication.
Once again, you're going to feel a little poke here.
The doctor gives him several PRP injections on this Saturday, but daily he gets a dose of reality, thinking about his wife and 4 children and the mental pain this causes.
Our youngest she's only 4, and so thinking about the younger 2 that have only really known me as an injured father, I think about all the times that I have to tell them, no, I'm sorry, I can't pick you up, I can't play with you this way.
And the ones that affect his personality, but of course chronic pain is going to make you just be more tense anyway, but it's been very difficult, and trying to be the person to make the home as normal as possible for everybody has kind of been my job.
Needle is inside the subacute.
Anthony's all set with the injections. Since PRP often gets coupled with other treatments, he stops by the 𝘕𝗎𝘢𝗎 medical laser booth at the conference. This powerful beam of light draws blood and nutrients to the pain site.
A patient will feel a mild warmth because of the interaction with H2O in our systems. It's only pleasant and sometimes relaxing, mostly. So we're promoting healing at a cellular level.
Set him up for the worst case scenario that you're not going to be able to move your arms for the next 2 or 3 days. So, you make them really nervous about it, and then they wake up usually the next morning feeling okay. And so it kind of helps reset their expectations, and they're happy.
When you woke up this morning, was that first question, how do you feel?
Well, yeah, he expected not to be able to move, so I asked him, do you need me to help you with anything? And he was good. I helped him with one thing this morning. But
While we reach, point, and raise our arms without even thinking, one false move on Anthony's part could lock up his shoulders.
I broke like 5 or 7 coffee pots in just a few months time period, multiple coffee mugs, those types of things,
It could be a few weeks, maybe a few months before we'll know whether his shoulders responded well to the platelet-rich plasma injections. PRP is not always a sure bet. But he does say that the short-term torture of waiting for that outcome is still better than the agony of never knowing at all. We'll keep you updated on his situation. Mike Doria, Gulf Coast Biologics.